Good morning, good afternoon, everyone. Welcome to ARA's Webinar Wednesday. I'm Jerry DiMaggio. I'll be serving as the moderator for today's program. On behalf of ARA and our speakers today, I want to thank you for joining the program. I'm sure it'll meet your expectations. So today, our topic is Beyond the COVID-19 Pandemic, and we're focused on the infrastructure industry. Next slide, please. I'd like to first cover a few housekeeping details with you. Next slide, please. Thank you. So, few housekeeping items. First of all, if you're experiencing some difficulty at your end, first check the audio and the visual at your end, make sure it's not a problem there. If you're still having some problems with the webinar, please check on the chat button. You see that highlighted here in this particular slide, and send a brief note to the host, and we'll offline help you out individually as best we can. Next slide, please. So as always, we entertain questions. We invite you to submit questions during the entire program. To do that, you see highlighted on this particular slide the Q&A button. Make sure the host, make sure you type in your question directed at the host and the panelists. And just as a reminder, we won't be addressing questions until the conclusion of the formal presentation. With that in mind, just as a reminder, this is a 60-minute program. We'll have about 45 minutes of presentation, including the introduction, and that'll be followed by about a 15-minute Q&A period. Next slide, please. Now, we do offer PDH certificates. We do also allow the registrant, and a number of you are probably doing this solo because of the pandemic, but if you're in a group, somebody individual registered your site, and you can download a PDF version of today's presentation, and that information is listed on this particular slide with the email address that you send that information to. So before I turn it over to today's speakers, just a brief introduction. Next slide, please. And today we have two pretty well-known speakers on the national front. Our first presenter is a good friend of mine, Mr. Dan D'Angelo. Dan has a long-time career, very successful leadership career with New York State Department of Transportation. When he worked in that career, he served in a number of senior roles including the Director of Design, Director of Design Quality Assurance, Deputy Chief Engineer, et cetera, and you could see Dan's credentials here. He's well-versed in a number of topics in terms of program management, risk management, and he spent quite a bit of time, unfortunately, like the rest of us, dealing with today's topic and done quite a bit of research, as you'll find out here. Next slide, please. Joining Dan today is Dr. Ahmad Alhasan, and Ahmad is a recent find for ARA. He's been working with us since January of 2020. He's well-credentialed. He's well-known for his work in statistical analysis, risk management, data-driven analysis, and he comes to us with a postdoc and PhD from Iowa State University. So with that, Dan's going to start us off. Ahmad will be joining the presentation a bit later. So Dan, I turn the program over to you.
Thank you, Jerry. Really appreciate this opportunity to present our observations and actions that we're taking to address the COVID-19 pandemic. But to say that this is an interesting time in our history is obviously an understatement. Seems surreal at times and crazy at times, for sure. In the next 40 minutes or so, we're going to cover these four topics shown here on the agenda. We'll cover a brief description or perspective on the pandemic, its highly contagious nature, and its startling impacts to several U.S. transportation indicators. We'll then look at a few specific responses by some infrastructure industry organizations. We'll discuss how to develop, or if you have a plan, on how to adjust that plan and how to take advantage of the data you have. And we'll finish with a short case study on how our organization is using the process we're going to describe and the tools to prepare a short and long-term action plan to deal with the effects of the pandemic. It's not possible in the next 45 minutes to go into a lot of detail and cover all the aspects of the pandemic, but we're going to sure try to provide you with a perspective on the major issues to consider, how others are addressing those issues, and how you can address them for your organization. So first, let us start out with asking some questions. You already be asking yourself these questions. If not, you probably want to consider these type of questions and think about these as we go through the presentation. So, how are you communicating? How are you communicating with your leaders, with your managers, with your employees? How are we making decisions? What data, facts, evidence do we have? What do you need? How can I take advantage of what others are doing or how others have responded? Do I have a short-term and a long-term plan? The bottom line is, what is your plan? What is your plan for moving forward? And by the way, if you want to go grab a cup of coffee and skip this presentation and come back in 40 minutes, I'll tell you the answer to all these questions right now. And that answer is, it depends, right? It depends on your organization. It depends on your role. It depends on your state and local area guidelines. It depends on your goals and objectives for your program area or organization. It depends on your financial strength. It depends on many things, right? So we're going to help you with those depends, and we'll describe a process that will help you identify them and help you answer these questions. So our first agenda item, the pandemic. This is a map from the World Health Organization, and the pandemic is defined as a global disease outbreak where there is little or no immunity to it and no vaccine. Right? Pandemics cause significant absenteeism, change patterns of commerce, have limited immediate medical solutions. There are none. They interrupt supply chains, right? All of these issues have a devastating effect on the operations and sustainability of transportation organizations. So worldwide, looking at the data this morning, I took a quick look. The world is still averaging more than 100,000 new cases a day. There's been 4.8 million confirmed cases and 318,000 deaths worldwide. This map shows by country the relative outbreak by country by size of those dots. And the U.S. has by far the largest reported number of cases and deaths. So the current spread, it's very contagious, obviously, and it's kind of scary when you look at these two maps here. So the upper left is March 1st. There were a few cases in the states of Washington, California, and New York City area was just reporting its first few cases. There are several spots in the Midwest. So the lower right, 2 months later, right, every state had a reported case. The dense urban area numbers grew much more quickly. More suburban and rural areas spread was not so fast. But within these 2 months, it doesn't appear that any part of the country was safe or unaffected, right? So the U.S. numbers are, as of this morning, 1.5 million cases, still showing 2,000 new cases a day. And unfortunately, we're already more than 90,000 deaths in the United States. So the good news, social distancing, or maybe a better word of this, physical distancing, stay-at-home orders appear to have worked or are working, slowing the spread and the number of cases as this graph shows. This graph shows just deaths, but remember those infected or sick number in the millions. Right, so the next big question I think we're all have on our mind or we're wondering is, as the country begins to open, and this morning the news was reporting that every state in the country is opening in some way, shape, or form, is will there be a second wave? And many experts are predicting not only a second wave but a third wave. So we need to keep an eye and monitor. So this graph is a predictive model. It's based on quantitative analysis. And later in this presentation, Ahmad is going to elaborate on qualitative analysis and how you can use this method to help your organization with developing a COVID-19 action plan, much like the leading organizations fighting the pandemic do. So hindsight is 2020. Let's take a look at a National Academies of Science National Cooperative Highway Research Program report that was published in 2014. This report addressed planning and responding to a pandemic. Focus was on public transportation, but if you read this report, it likely would give you goosebumps. There's some very interesting content in here. So one of the topics they address is, why is it important to plan in advance? And that topic is subtitled, "Won't the Centers for Disease Control give direction on what to do?" And the report goes on to describe, during a pandemic, the Centers for Disease Control and Prevention and all the way down to local public health organizations provide information, but they don't give instructions to specific types of organizations, right? So transportation agencies that didn't have an understanding of this, of pandemics, and did not have plans in place were likely in a position of struggling with to react safely and effectively. The pandemics, they report out pandemics are much different than major issues that we're as transportation infrastructure organizations are usually dealing with, things like earthquakes, hurricanes, hazardous spills, incidents. These impacts affect infrastructure and cause physical damage to people and structures. Pandemics are much different, right? They affect human resources and society in general. So if you had a chance to look at this report, I suggest you do. It has 7 chapters. It describes how to evaluate your organization if you're prepared for pandemics, how decision-making and partnerships are necessary, how to prevent the spread of the disease. It's providing services during pandemics, how to address your workforce, and obviously, probably the most important thing is communication, right? How to communicate during crisis and emergency situations. So if we look at one table from this report, there's 3 main categories of impacts to transportation organizations that were identified. And these have to do with the workforce shortages, right, confusion and fear among not only the employees but the public, and strategies to limit the spread, right? All these should all sound familiar to everyone by now. Bottom line, the report is about being prepared, about having a pandemic plan. It suggests a tiered approach. The report notes there is usually a time period as the event unfolds to react, and it outlines 5 levels of a pandemic phases, if you will, that they usually go through, right? So the first phase is Tuesday's word of a pandemic coming. What's that standby alert monitoring phase, right? We were doing that in February and March. Then there's minor impact stage. We saw that again probably in March, right? And then moderate impact, major impacts, and the catastrophic impacts. I don't know if we're at the catastrophic impacts yet, but somewhere in that moderate to major impact for sure. Again, an interesting report if you had a chance to read it. A lot of great information in it. So now let's look at some data to put this in perspective for the impact on the infrastructures, transportation infrastructure. Right. So this graph shows an amazing and it's quick, almost instantaneous drop in air travel from February to March. So it's a 50, 51, 52% decrease in air traffic that happened really quick. The April data is not out yet, but a lot of reports are showing, or preliminary reports are showing that air travel decreased not more than 90% in April. So pretty dramatic impacts on the traveling public. If we look at the freight indicators, Freight Transportation Services Index, although it's not as dramatic as the air traffic, from previous years, there is a decrease. It'll be interesting to see what the April data shows as it's released. There's a little bit of lag in this data. If we look at the American Society of Civil Engineers, they've done some really good surveys on the impact to the infrastructure organization industries. Some of their highlights, they've done 2 studies, one in March and one in April. I believe there is a 3rd one underway, so you can see how things are changing. So what they're finding out is that 90% of the organizations are reporting a negative impact to revenue. Almost a quarter are a severe impact. A 1/3 of the organizations have made a reduction in employees. Typical workforce maybe is reduced by around 10%, I think they're finding. A 1/3 have reduced spending on advertising, and a 1/4 have reduced spending on technology. So all this indicators is probably maybe obvious to a lot of people, but when you look at it in the industry as a whole, it's quite alarming What this graph shows, if you look at the concerns by each organization, and the bottoms here, the size of the organization, the dark blue graph or bar is actually indicates if government didn't intervene or didn't provide some support, how the organization would feel. So what this is really saying is most organizations believe that government intervention is necessary to reduce long-term impacts, right? Whether it's a stimulus bill or a new transportation authorization bill is necessary. So what actions have organizations been taking? This was also part of the survey. If you look, this graph shows from March to April what organizations are doing. A lot of these, I'm sure you're all living them every day right now, is the distancing of employees to work from home, canceling all in-person meetings. Those offices that are still open, they're not allowing visitors. A lot of safety reminders about personal hygiene. There's concerns about getting supplies for hand washing material and so forth. Right, working from home and setting up IT, and all these things. A lot of travel ban. Organizations just aren't traveling. I think FHWA has told me they're not traveling through the end of the year. So these all have significant impacts on our business, particularly when we're a very collaborative business, and most of our work is done in teams. So AASHTO, so they're also tracking the impacts. They have, if you haven't looked at their website, it's great. They are monitoring the news reports coming out of all the states, and they throw up the links to those articles and highlight what the summary of those articles are. So this is just some select state impacts to kind of put this in perspective. If you look at Maine, Illinois, Ohio, New Jersey, most every state is reporting a significant financial impact to the revenue streams. And this, if you look at this, is directly related to the stay-at-home, the lack of traveling that's going on based on the gas tax, right? Miles are down, gas purchases are down. Our revenue streams that most of the states are relying on are dried up or have decreased significantly. In addition, there's significant impact to overall government budgets at the state and local level in order to fight the virus, and what impact will that have on the DOT budgets within the states is really a big question. Let's look at some of the transit numbers. This is just a representative example of impact on transit ridership. I went to state of Washington, Seattle, and looked at their transit, their bus system on the left, and their train system on the right. So a weekday travel, business travel, it's quite astounding, right? They saw a 62% drop in average weekday ridership and 73% on the transit rate. So, some employees are starting to get back from work from home policies, or a lot of firms are considering maybe having more people work from home long term than they have. So what impact will that have on transit ridership? So are there going to be some significant changes in riderships long term? And obviously riderships correlate to revenue streams to support these systems. So what are some other overall impacts? We all know the headlines, the major and significant impacts. Some specific to our industry. I mentioned the government budgets, the revenue streams, not just for transportation, but the government as a whole, and reductions that may be necessary across the board. We talked about the revenue streams, but also projects, right? We look at a lot of projects have either been put on hold, stopped, or delayed. There's been almost a complete stop to in-person training activities, meetings, information sharing, workshops, conferences, those type of activities. On the other bright side, there's been more online educational opportunities, people taking advantage of it. And as I mentioned, travel pattern changes. Are there going to be significant travel pattern changes with more people working from home? Will people shy away from transit? Will they go back to their cars? All those changes are evolving, and we really don't know right now what's the long-term picture is, but there's enough evidence coming out now to start considering and looking at these things. So that wraps up kind of a perspective of the pandemic and the impact on our on our industry. So how is industry responding to this? This is the second agenda item. So I'm going to go back to AASHTO. They also, besides tracking the impacts, they're also tracking what people are doing to adjust to it, right? So some select, so this is just some select information from that tracking system on their website. Florida, for example, announced recently that they've accelerated projects that taking advantage of the lower traffic. But we're seeing more states than are halting or slowing down work than suspending, delaying projects due to COVID-19 than accelerating. Rest areas are being closed. States got very innovative and looked at truck vendors in order to handle the people that still were traveling and how they could provide services to them. So that required modifications to some of the rules, regulations about running rest areas on interstates, for example. A lot of states waived or increased truck weight limits so supplies could be delivered faster, didn't slow it down with the permitting process, so permits weren't required. Variable message boards were being allowed to be used for the COVID-19 to send out those messages as opposed to saying to the safety of the traffic, so that FHWA approved that. And interesting, one of the interesting tidbits I came across was with the fewer drivers, speed has increased, average speeds have increased on a lot of highways, and certain states have taken actions to monitor and control that speed through stepped-up enforcement to reduce the chances of accidents and so forth, and just to provide safety for the overall public. So if we look at, before we go any further on how industries are responding, I think it's important to recognize how you respond is dependent upon the regulations and rules and guidelines that are published in your political jurisdiction area or your state. So I'm in New York. I'm from New York, so I'm most familiar with New York State's process. So I'm just showing this as an example of how one state is handling reopening. And I know there's a lot of information on the slide. I'm just going to walk you through. I'll pick the capital region here and just walk you through it. So New York State has 7 metrics. Several of these are based on 3-day averages, as shown on the slide. And the metrics are hospitalizations, hospital deaths, new hospitalizations, the bed availability in the hospitals, intensive care unit availability, how many people are being tested, and do those areas of the state have contact tracers available to track any new outbreaks, right? So 7 metrics, and the state is divided into these different regions, and if you meet all those metrics, you can reopen, right? So this shows, for example, a capital region, and this is a few days old. I believe that as of this morning, they've actually met all of them, so they're going to be able to reopen. So this right column is the important column, shows which parts of the state of New York have met the metrics that have been defined by the New York State government. And if they met them, you can open. Right? And the opening is in phases. So that's another important factor. It's actually a 3-phased approach. So phase 1 opening is only certain industries, and construction is one of those industries. Now, the national reopening picture, it's interesting, it's really all over the place, right? So certain states are handling it different than other states. Paying attention to the news, or you're reading the news and you're staying up with all the information on this, right? This map shows states that have a total reopening or partial reopening, or still are shut down, right? And again, I heard this morning that all states in some way, shape, or form are opening partially or totally. Right, so you probably saw the stories about Wisconsin's Supreme Court eliminated the governor's stay-home orders, so they leaving it up to the cities and the county officials to figure out how they're going to open on their own. Texas had a statewide opening on certain businesses on May 8th with certain restrictions, like restaurants at 25% capacity. Florida opened the whole state except for certain counties. So the point here is how your state reopens, or how your area where you work or your projects are will have an impact on your plan, right? And how they will be closing. New York State has a plan. If those metrics decrease, right, those areas are going to be closed back down. so there's no the spreading doesn't occur. So there isn't a second wave or third wave. So New York Times carries this graph, so you want to see how any jurisdiction is going. It's a great resource to go to their COVID-19 page. All right, so let's go back to how certain industries are handling or providing advice and recommendations for their member organizations to handle it. So the National Academy of Construction has provided guidance on how to address ongoing projects. Right, they're suggesting every project establish a point of entry. Right, so allowing for 6-foot spacing as people enter the work site. You have a physical barrier between the screener and the entrance. Screeners wearing PP, personal protection equipment at all times. If employees, they suggest employees refuse to be tested. They are sent home. They're not another refused entry. They recommend that the screeners have a health service background. Don't take someone from the work site and put them in there and do the screening. They should be trained in proper protection. What's the process that your site should establish? Having temperature checks, right? Washing hands, entering and leaving, be able to answer questions. And then the workspace, right? Once you get to the work site, maintain a 6-foot separation where possible. They'll have wash down and bleach stations for equipment and shared uses. Have one-way paths on the work site, stairs up and down. Have different or certain times. All this is being recommended while we figure out the pandemic and how it plays out. They also provide guidance on how, for the projects that have been shut down or closed, on how to reopen. Very similar to a new project, but to restart, there's a lot more advanced work that needs to be done, right? So what's that advanced work? Do you have a remobilization plan? Do your subcontractors have a plan? You should confirm your manpower is available. Are people sick? Are they willing to come into work? The whole supply chain issue, right? Is material delivery available? Are long time lead items, can they still be delivered? What's your new schedule? What are the new critical path items? Do you have your insurance in place? A lot of companies have canceled or stopped their insurance while their jobs are shut down, so they're not paying premiums. Make sure all that's in place. Again, the startup, the screening, like we just talked about, and then the whole safety aspect of the site and equipment cleaning, social distancing, staggered schedules. Are you providing protective equipment for your employees? There's an example of a state working with their Associated General Contractors, AGC organization. They've developed a process for all their projects. The state of Alaska has a lot of construction employees coming from out of state, so people that are coming back to state will have to self-quarantine for 14 days. They're requiring health screenings. They're setting up the 6-foot guidelines for the work site, one-way pass and so forth on the work site. And they're recommending all these new guidelines be established for projects on hand washing, equipment maintaining, and so forth. So you can go to the Alaska DOT's website and take a look at how they're handling it with in cooperation with their construction organizations. So a lot of you are working home. Offices will be reopening soon, or maybe already in the process of reopening. What changes? How are you going to address with that, right? So there's a lot of things to consider here. Physical office changes, for example. Are you going to eliminate the open floor plans? Do you need desk dividers? How's the airflow on your floor plan? What's the cleaning process? Do you need to separate desks further and maintain that 6-foot disinfecting processes and materials and supplies? What's your protocol for screening employees? Will the company again provide personal protective equipment? In compliance with, say, CDC recommendations? What's the liability for your company if someone gets exposed at the workplace? Is there insurance coverage? Those type of issues need to be thought through. Will there be more remote work? For example, those with underlying pre-existing conditions that may be affected by the pandemic more severely than others. My son has a pre-exposed condition that his doctor just said no contact for 30 days to any people. They want him not even come close to taking the chance. So those are the type of things you need to consider about your workforce. And then the communication, obviously, is a big issue. It's been absolutely amazing how well I think it's gone over with all the remote working and how well communications have worked. But for long term, do you have the right apps, platforms, IT to support the software? Do you have a policy for all that? Those things need to be addressed. All right, now we look at the other issue to consider is the funding and budget shortfalls. We've talked a couple of times about the government budgets having to deal with the pandemic and how they're short. There's been $3 trillion in the economic recovery at the national level to date, but none of it really has been specific for the infrastructure. There are benefits to companies for payroll and so forth, but nothing specific to the infrastructure. There's talk of another $3 trillion response being discussed. That's obviously very political. Several groups are strongly urging that infrastructure investments be a significant component of the next stimulus bill if there is one. And don't forget, the FAST Act expires September 30th. So even though we're going through this pandemic, Congress is addressing. So they're actually meeting and talking about the next reauthorization bill, and that will be something important to keep an eye on. All right, so third item on our agenda was developing a plan. We heard, first item was with the pandemic, how it's impacted us. Second part of this agenda item was how others are reacting to it and how they're responding to the pandemic. Well, what's your plan, right? So how do you develop a plan? So do you have a plan, I guess is the first question, right? And if you do have a plan, do you have a process to adjust it? How do you separate the political rhetoric from reality and get to the data, the facts, the evidence? Data is limited, but it's also changing. We have all these budget challenges, short term versus the long term. So you need a disciplined, structured process, one that is flexible and adjustable. But again, structured and proven techniques. So at this point, I am going to turn over the presentation to someone much smarter than me on these areas to discuss how to deal with using qualitative analysis and quantitative analysis and the pros and cons of each to deal with COVID-19. Ahmad?
Thank you, Dan. So I'll just go ahead and discuss the plan that you've been talking about. So first of all, defining a process, we suggest among the several available processes to manage pandemics and emergencies, basically risk management processes. Risk management overall can be active or passive, and we'll have a brief discussion on that. So on this slide, we can see a flow chart showing basically the overall risk management process, where it starts by identifying goals and objectives. Again, this is a very critical step in the flow chart, because depending on your objectives and goals, you have to be flexible and change the action plans and so on to respond to the pandemic. And then the second step would be identifying risks, and that would be looking at threats, challenges, opportunities, basically some kind of a SWOT analysis. And again, one thing I would like to point out, that risk is a more generic term that includes opportunities, threats, and also includes the quantitative measures that comes with it. Also, one thing is to try to simplify the analysis and combine the resources to deal with, and then a following step, start assessing risks qualitatively. So we're suggesting moving to qualitative analysis, prioritize your threats or opportunities, the highest risks that you want to deal with, and then move forward to quantitative type of analysis. And after that, try to come up with response strategies and update these strategies. And we will talk about updating and changing strategies with time, since this event is continually changing. Next, please. So now, why risk management? Why did we pick that specific aspect, again, as some of you or most of you might know that risk management overall deals with uncertain events, uncertain in terms of the probability of occurrence, and also uncertain in terms of the characteristics of the event itself, which means how long would it take, the extent. All of these are uncertainties that we cannot pin to a single number, and they also depend on how you define these risks and so on. And also these events can have positive and negative impacts. And then I've been talking about shortfalls in budgets, impacts on projects, but also with the opportunities come great responsibilities, I would say. So with opportunities that might happen of having multiple projects, since we have less traffic, or we would have some kind of stimulus funds and so on coming along. If that happens, then there are opportunities, but also responsibilities to manage these opportunities. And finally, this risk management is the tool to handle these uncertainties. But also one thing to point out that there is passive and active risk management, I would call it. So the passive risk management, you would have a plan ahead of time. But in the case of pandemic, we don't have such plan. Normally, you would have a generic plan. So it has to be an active process where you update and keep changing in response to what occurs over time, or how it changes over time. Next, please. So again, Dan mentioned that risk management is a structured approach. It's traceable. It can be justified and can lead to subjective outcomes. It is a very helpful and excellent communication tool. So it's not only the analysis that matters, but also how to communicate that analysis. So risk management provides that opportunity and provides the opportunity to gather more information and so on. And it also forces, in some sense, the focus on data. Try to collect as much data and be more objective in the decisions that we're making, and try to derive more decisions based on data. And also it can help minimizing the biases. If we talk about risk management, if we have multiple inputs, then the bias towards one scenario would be less, and so on. And it also, again, focuses on threats and opportunities rather than the individual and organizational components. Next. So these are some of the tools out there available, and these tools, I would say, are more on the qualitative side of risk management, but they will also play a major role in quantitative analysis. So this is more like an overarching generic tools that we would use, and especially at the early stages of planning risk management, and keep an eye on the inputs from individuals. Try to have multiple inputs from multiple people to minimize the biases again, and focus on the strengths and weaknesses, opportunities and threats, and do all the brainstorming that it needs. Reach out to other agencies or other entities to learn from their lessons and how they reacted and what are their observations. Next, please. So now I would like to touch base on the quantitative and qualitative aspects of risk management. So quantitative data, again, it's numbers. We know how to deal with numbers, generally speaking, but also there might be limitations in getting such numbers or data. So you would rely more on basically something that is measurable and repeatable. So numbers is not only also assigning scores, for example. Does that qualify as quantitative analysis? Most probably not. Qualitative analysis is more based on judgment and the senses and the common sense that develop and evolves over time with experience. So qualitative analysis, especially for pandemic, would be, for such case, and their impact on infrastructure would be helpful, especially in early stages, to come up with decisions on how to handle the next steps, and then move forward to a more detailed analysis, because some agencies won't have, or entities won't have the resources available to handle quantitative analysis early on. Next, please. So this slide also shows the advantages and disadvantages. We've picked only 2 advantages and 2 disadvantages of qualitative analysis. We will not discuss details on what is helpful in qualitative or not helpful, what are the shortcomings. But overall, it is a simple tool. It does not require very sophisticated mathematical structure, but also at the same time, it requires experience and expertise and sound reasoning and judgment. Also, it is a very powerful tool to communicate the message to management, basically, and other entities, even going up in the hierarchy to government and so on. This is a very helpful tool, but it can be disputable, so it can be less consistent and it leads to less objective decision-making, I would say. So let's just focus on a very simple example in here, handling the impact of COVID-19 on infrastructure industry. So in this matrix in here, it's a 5x5 matrix, very common risk analysis matrix or risk evaluation. So the first scenario would be, what about the lack of funding and shortfall in funding that we've talked about? Let's say that the agency performs all the meetings and brainstorming, which requires collect data as well. So even with a qualitative analysis, you would need some kind of data to look at, basically reports, previous reports, what's going on, all the the experience that is happening with other agencies. And let's say an agency sees or qualitatively assign that there is a possibility to have some kind of moderate shortfall in funding, but not significant shortfall in funding. So with that, you would see the first star, and then also the same agency would look at the impact of workforce, what COVID-19 would have an impact on the project itself, the process of the project, and the agency looks like this is a likely thing to happen, that it would affect the project and so on. It would have a significant impact on projects. So then that's the second scenario that to be considered. So looking at that, maybe at the short term, let's start dealing with basically the workforce impact. Next, please. So now to handle that, we would suggest moving into quantitative analysis, and this is a flow chart of the process. It is somewhat similar to the overall process. So you start by identifying the sources of risk and do some kind of data collection and simulation, and then do the uncertainty analysis, and we'll touch on that briefly, and then look at the consequences coming out of the possibilities of these impacts of COVID-19, for example, on projects and so on, and then try to come up with risk measures to quantify the impact of individual projects or individual elements, and then look at the overall impact at the network level, at the agency level, and so on. Next, please. So again, these are the advantages, disadvantages of quantitative risk management. Quantitative risk management, if it's going to be most probably robust, but it also can lead to some kind of placebo effect that we know it all, but in some cases the analysis does not help. And that actually part of what happened with COVID-19 at large, that we know it all, and many scientists knew that something is going to happen, but nobody had numbers to it, and so it was in the low risk category, I would say, until it happened. So that's another placebo effect and so on, but overall it should be more robust, data-driven, and be more objective, but it would require some sophisticated tools. Next, please. So going back to the forecasts that Dan mentioned previously, so these forecasts are basically built on quantitative models. So part of the uncertainty analysis step is to forecast into the future and try to define the uncertainties that associated with these curves. So in this curve, you can see the future or projected forecast. There's the blue line, and that's the average prediction or the expected value. I wouldn't say the most predicted number, but this is the expected value. And then the other two boundary lines, the red lines, are basically the prediction intervals or boundaries. And these come from a distribution, actually, that you can envision that is overlapping these curves. Next, please. So if we look at that distribution, so the expected value would be the red line and so on, and the distribution would basically cover the boundaries that we were talking about. So that's from the uncertainty analysis perspective, and then you propagate these impacts into the project impacts that we're concerned with on infrastructure industry. So we start with that, see how would that affect, these projections would affect the economy, and that would require sophisticated analysis maybe, or simple analysis. It depends on what you are trying to achieve. Some possible tools are Monte Carlo simulations, for example. Some of you are familiar with those. They help in scenario analysis and propagating these uncertainties. Next, please. So we've talked about the basically distribution over these predictions. So this is, I would say, a cut into the curve, and you look at the distribution. Again, this distribution is called a probability density function, and it's a statistical distribution describing the probabilities of an event. So next, please. So look at the area between two boundaries that would define basically the probability of an event happening within these boundaries. So that's what is a basically probability density function. Now, one thing to point out when performing such analysis, when doing the uncertainty analysis, this is again propagated all the way to the impact on infrastructure. But now one thing, things do happen and change over time, and that's very evident, and a lot of prediction curves actually fail, some of this succeed. So it is very important to keep updating your information, and here kicks in the Bayesian approach, or the Bayesian approach to risk analysis and risk management, is to keep updating your curves. And so with the Bayesian approach, the first assumptions that you had, or the first analysis you've done, that's a prior knowledge becomes, and over time, as data comes in, you start updating these curves, and that updating can happen over multiple rounds of first observation, or first round of observations and second round of observations. These curves will continue updating and changing, and your predictions would be more and more accurate. And also one other major advantage of Bayesian analysis is that you can even quantify the uncertainty, or how far were you before the new data comes in, and that would help you knowing that, okay, in the next round, how far would I be since I have been that far in the first round before collecting data. On that note, I would pass it back to Dan.
Thank you, Ahmad. That was very interesting explanation of the Bayesian approach. So I'm going to briefly cover a case study. The case study is our company and how we use the process we just talked about to develop some short and long-term action plans. I'm going to go through it really quickly and briefly, so if you want more information on this, please just contact me afterwards. We use this process that we just described. You know, as Ahmad said, you start out with you got to have a clear goals and objectives in order to do any analysis, right? You can't adjust your schedule, your scope on a project level, or even an organization level. You don't know what your goals and objectives are. So we had an existing business plan, like I think everybody does. That was our starting point. That's where we are. We had a 5-year plan. We had all these goals and objectives. How is this going to impact our current business plan? We actually had a company-wide leadership meeting plan for March or April. I forget exactly what day it was. That obviously got canceled, so we did this virtually. We actually turned it into this risk workshop, if you will, a risk analysis. So we began with a SWOT analysis. We had every employee provide, all the management leadership of the company provided individual input to a person, who then collected this and collated it before we met online. During the online meeting, we broke out in groups by separate teleconferences. Those groups then looked at all that individual input. They prioritized, ranked the responses we got from our management. They identified solutions or actions to be taken to address them, right? So the breakout groups then came back and reported to the whole organization, and this resulted in an overall business plan, right? So the benefits we saw of using this process involved a large portion of the company employees. The supervisors or leaders actually solicit input from their employees. We got to see everyone's perspective. We got to learn facts that people knew that maybe others didn't know. It was taking really the big picture into focus, to provide focus on the organization. It was rather motivating and inspiring to have involved and being proactive to deal with this. And again, as Ahmad mentioned, it was a strong tool for communication, right? It just got everybody seeing the same information, everybody was communicating. And now the plan is being adjusted as we go forward, as more information and data is known. So I just got really quickly just show you a couple examples. So one of the things we identified right away was, well, this is going to require everybody from working from remotely, right? So we said, what are the strengths or weaknesses? These were internal actions that we had to take. We had a strong IT. We thought we had all the software to do it. That was great. But also we wanted to show our clients that we're not going to go away. We're still here. We can still perform. And then there was some other opportunities to expand the use of that. The other area I've just only picked two of the topics was the IT risk. We felt that we had a strong IT group that could do this, and our company had the bandwidth and the software to do it. But we weren't quite sure, right? So that was a weakness that we had to jump on right away and make sure. And we did have to make some changes to allow employees to have access to all the tools, internal networking as well as external. And again, this was a way of demonstrating as an opportunity that we can provide support to our clients. I know that was quick, but we're in the phase now of taking a look at some hard data and doing some more quantitative analysis at some more of the specific areas from our financial aspects as an organization, as a company, along the lines of what Ahmad talked about. So I'm going to, in interest of time, I'm going to wrap it up right here. So just summarizing our presentation, we provided a brief perspective on the pandemic, its highly contagious nature, its startling impacts on some indicators. We looked at how others are responding to it, how we can benefit from that. We discussed how you can develop a plan or modify your plan. And we tried to provide an example of how we actually use the process we just talked about within our own company. So I'm turning it back to you, Jerry.
Okay, thank you, Dan. Dan and Ahmad, thank you for a great presentation. We hope everybody enjoyed today's presentation. We've got a few more slides to share with you. ARA Webinar Wednesdays have been active. We initiated it in February of 2019. You see on this particular slide a couple of items that you might be interested in. Carrying us through September, we have presenters and topics identified through December of 2020, which is exciting to know. You'll also note that we kind of try to mix topics up based on our areas of expertise and knowledge and experience. And if you're interested in registering for any of the programs you see here, you'll see some future announcements. We'd like to begin marketing about 2 or 3 months out. You see the www where you can connect. I would also like to mention all the webinars are recorded. So if you have a colleague or yourself want to refresh on one of the previous webinars or today's webinars, you can go to that same registration site and get information in terms of how you connect with webinar recordings. Next slide, please. So I'd like to spend a little bit of time on Q&A, and we've got 5 questions that have come in while we were listening to Ahmad and Dan present. First of all, you see their email addresses here, and they've been gracious enough to, sometimes people have a problem typing a question while they're trying to listen and watch the PowerPoint presentation. So through Friday of this week, if you have follow-up questions for either Dan or Ahmad or both of them, please send them an email with a specific question. They'll do their very best to answer those questions or point you in the right direction, as they say. So let's spend a little bit of time talking about the questions that we've received. The first one, and I'll ad-lib a little bit, and I'll leave it up to Dan and Ahmad to decide who's going to answer, or both of them will, is there's such an enormity of available data and information how do you know what's a reliable source and what's not a reliable source, and you're being fed perhaps not accurate information?
Yeah, this is Dan. I'll take a crack at answering that. I mean, that's a great question, right? We're in the news stories recently. You've seen several states have been accused of not sharing accurate or portraying data in misleading ways for whatever reasons, right? So that's a real issue we all struggle with. You know, my answer is look at as many multiple sources as you can to see what kind of themes you get, right? And then obviously there's certain organizations that are more reliable. I mean, everybody has, you know, we talk about bias a lot. Every organization has a little bias or a little focus, but I would stick to some of the organizations that we showed: AASHTO, TRB, AGC, the County National Association of County Cities, you know, academic institutions where this data is available. And I think if you look at enough of it, and also look at the research that's going on, you'll see the themes, right? And I think the misleading information gets, you know, will disappear if you take that approach. And Ahmad, I don't know if you have any further thoughts on that.
I think you've covered it pretty well. Thanks.
Okay. So move forward. Oh, go ahead, Ahmad. Yeah. Yeah,
but I would like to add on, besides the reliability, the type of data that is being received and how to actually aggregate all that data. So one thing, especially, again, when mentioning quantitative and qualitative analyses, basically try to get quantitative data that is reliable, because otherwise it would lead to what we've been pointing out, the placebo effect that we know it all, and that would be damaging for actually the risk management plan to respond.
So, second question from Mary, and we may run over a minute or so. We've got 4 more remaining questions. It'd be worthwhile to cover them if we can. So please stick with us. So, a question from Mary is kind of how do you get started with developing a plan, and who should be involved if we're beginning to think about the outline of a plan similar to what you covered, Dan?
Yeah, Mary, I mean, that's another really good question. And it's a challenge, right? So it's a top-down, bottom-up type approach. Personally, you know, I like communicating with as many people as possible, or involving as many people as possible. But I recognize that it's not always possible in an organization. I think you need to start with the leadership and management, right? Someone's got to be clear on the goals and objectives for your organization or your program area. Are they staying the same? Are they being changed or modified? And you know, maybe it's an iterative process as you go through some risk analysis. The goals may change as you find things out, but you need to have a starting point. So you have to start with your leadership and management, and obviously that helps with buy-in and for employees. Second, I would involve as many people as possible. You know, we in our company, right, we took 180 of our managers and leaders and involved them, but we encouraged them to talk to all their employees. So we were getting as much input as we can, and that's important in these type of activities. You know, we talked again about, you know, the most common bias that we all have is confirmation bias, right? So we tend to believe in things that support our views already and give them more credit than they probably deserve, and then we discredit things that are counter to our views. So the more people involved, the more you're going to break that down and you know, get to a better end result. And Ahmad, you have some experience probably in some of your research in doing these things.
Yeah, actually, one thing to also add is involving the people that are responsible for executing projects, and maintenance people that would know better how the process would go, for example, in selecting projects and performing these projects, because that would provide a great input to upper management.
Yeah, that's a great point, because the more people involved, the more they're going to buy into the solutions and help you implement, right? They're going to have to execute them. So I guess the simple answer, Jerry, is the more the better.
Well, I think you adequately addressed Mary's question. So I'll ask the question and I'll ad-lib a little bit here, we're so engrossed in the immediate needs of what we need to address. What are some of the long-term issues that deserve consideration to be addressed as well?
Yeah, boy, that's another great question. And I think actually, from what I'm seeing and talking to other companies, organizations, you're absolutely right, Ali. Everyone's so busy dealing with today's problems, or they're not thinking about the fall or next summer. You know, will there be a vaccine, right? You know, if you look at the data on vaccines, right, the fastest vaccine ever created has been 4 years, and that was for the mumps. Yet we're predicting a vaccine by the end of the year. So is that realistic, possible? And if you think it's not, it's probably not likely. So some of these conditions may be long-term, right? So it goes back to the office environment, remote working. You know, what's your plan for dealing with that? Are you addressing? Are you thinking about that? Do we have to start making structural changes now for long-term? And that's just the office environment. And then obviously we need to pay very close attention to the stimulus and the FAST Act reauthorization, because that'll be it's traditionally a 5-year bill, so that'll lay out a lot of how funding works, at least in the highway, bridge, you know, airport industry, how the longer term is going to play out. But no, great question. I think, you know, we just got to do more planning at this point than we maybe are doing as an industry, more longer term planning.
Okay, let me, if I can, before maybe Ahmad has something else, but let me move on so we keep everybody to their billable hours for the day. The fourth question, and this comes from Susan, is, again, I'm paraphrasing, if there was guidance such as NCHRP 769 report available, why does it appear that we were so unprepared for this event? And I guess the answer probably should be focused on transportation. That could easily drift into other things. So I'll leave it to you guys to decide who will address that.
Yeah, I mean, I can, unless you want to start out, I can take a quick.
No, just go ahead, yeah.
Yeah. I mean, so, you know, you've heard from like in risk management that this was a black swan event, right? Black swan events are just totally unknown. And this was not a black swan event, right? They've been predicting this. We've actually gone through not maybe as widespread as this virus or as contagious as virus, but other viruses. So yeah, why are people not? Why weren't we more prepared? And a great question. I'm not sure I have the answer besides what we were just talking about. We tend to get away from long-term planning. A lot of organizations, their risk processes are maybe very good in projects, but they're not in program or enterprise level. You know, it requires some dedicated resources and focus on those areas to think that through. And what kind of contingencies plans they have in place for any kind of disaster. You may have them for key infrastructure components being taken out of commission, but you may not have them for things that affect the workforce like this. So, again, I think we've probably gotten too far away from some long-term planning that, as an industry as a whole, and focusing on these. But clearly a lot of people have focused on it, and that report's a great example of. You read it, it's very eerie, right? It's like everything they predicted in there has happened, and so it's not like we didn't know about it or couldn't happen. We did. I'm not sure I have a great answer, Jerry, for that one.
Oh, that's okay. So the last question, and this is a flip question from Jerry. Maybe I sent this in myself. That if everybody's working from home, will our industry survive? So don't even honor us with a response to that question. Of course, it's actually going to grow and things will return to normal. So that concludes the questions. I do have 2 more slides to share with you, and we'll let everybody get back to work momentarily. Next slide, please. So just a reminder slide. I showed this earlier in the presentation. The PDF version of today's presentation is available for those who registered at your particular site. That can be downloaded and shared. We do not share PowerPoint slides with anybody. They're intellectual property of the company, individuals who will develop them, unfortunately or fortunately. And if you want your PDH certificate, you go to the location which is highlighted in slide 52. And if you have any questions, just reach out to us. And then finally, slide 53. So ARA is a vibrant company, as those of you who don't know us well, and those that know us well do know my statement was not an understatement. We're always looking for key hires. So there's a website that you can go to. What you'll find on that website is the current vacancies, which we have. That, of course, changes almost on a daily, certainly on a weekly basis. And then we'll be instituting another location where you could send an email if you're interested. I think you've got great credentials that match our mantra and our culture. We'll have that up shortly. So I want to thank everybody for staying with us and joining today's presentation. Thank Dan and Ahmad once again. Please stay safe and healthy. Things will be normal sooner than you think. Take care. God bless you all.